Good morning, Mr. Henderson. How are you feeling today?
Morning, nurse. I'm feeling a little better, I suppose. Still a bit weak, but I can breathe easier now.
That's good to hear. I'm glad your breathing has improved. The reason I came by today is to check on your progress and talk about the plan for the next few days. The doctor mentioned that you're recovering well and might be ready to go home soon. How do you feel about that?
Well, to be honest, I'm not sure I'm ready to go home yet. I'm still quite tired, and I live alone. What if I start feeling worse again?
That's a very understandable concern, Mr. Henderson. It's quite common to feel uncertain about going home after being unwell, especially when you live on your own. Can you tell me a bit more about what's worrying you most?
I just don't want to end up back here again. Last week, I could barely breathe. It was frightening. I keep thinking, what if the infection comes back and I don't realize it in time?
I can imagine that must have been really scary for you. Pneumonia can be quite serious, and it's normal to feel anxious after such an experience. But I want to reassure you that the treatment has been very effective. Your oxygen levels are back to normal, and your chest sounds are clear now. The antibiotics have worked well, and the doctor is switching you to oral medication to continue your recovery at home.
So, I'll still be taking antibiotics?
Yes, exactly. You'll take oral antibiotics twice a day for the next 7 days. It's very important to complete the full course, even if you continue to feel better before it's finished. Stopping early could allow the infection to return. I'll give you a written plan with all the instructions before you leave.
All right, I can do that. But I'm still worried about managing on my own. My daughter lives in another city, and I don't really have anyone nearby.
I completely understand, Mr. Henderson. It can feel a bit daunting when you don't have immediate family close by. The good news is that you're already through the worst part. Your body is healing, and with a bit of rest and self-care, you'll continue improving. Also, we'll make sure you have follow-up support. The doctor will arrange for your GP to check on you in about a week, and if you have any problems before then, for example, if you develop a fever, feel breathless, or have chest pain, you should contact your GP immediately or come back to the hospital. You won't be left on your own.
That's reassuring, thank you. Is there anything special I should do at home to help myself recover faster?
Yes, that's a great question. The most important things are rest, hydration, and nutrition. Make sure to drink plenty of fluids. Water, tea, or soup are good choices. Try to eat balanced meals, even if your appetite isn't fully back yet. Avoid alcohol until you've finished your antibiotics. Also, take it easy for the first week. No heavy chores or exercise. Your body still needs time to regain strength. Gentle movement, like walking around the house, is fine and actually helps with your lung recovery.
I see. And what about sleeping? I've been coughing at night. It's not too bad, but it keeps me awake sometimes.
That can happen as your lungs continue to clear. Try propping yourself up with an extra pillow. Sleeping slightly upright often helps ease coughing. Also, keep the room warm but not stuffy, and avoid strong smells or cigarette smoke. The cough should gradually improve over the next week or two. If it worsens or you notice any new symptoms, contact your GP.
All right, that makes sense. I'll try that. I just hope I don't feel as weak as I do now once I get home.
You might still feel a bit tired for a while, but that's perfectly normal after pneumonia. Recovery takes time, sometimes up to several weeks before your energy fully returns. Listen to your body, take breaks when needed, and don't push yourself too hard. Would it help if I arranged for a community nurse to call you a few days after discharge, just to check on how you're managing?
Yes, that would be great. I'd appreciate that a lot.
Perfect. I'll make sure that's organized before you leave. They'll check on your progress, ensure you're comfortable with your medication, and answer any questions you might have once you're home. Before we finish, do you have any questions or concerns about the medication or anything else?
Hmm. Just one thing. You mentioned I should take the antibiotics twice a day. Does that mean every 12 hours exactly?
Yes, ideally. Try to keep the doses roughly 12 hours apart. For example, one at 8 a.m. and the other at 8 p.m. You can take them with food to avoid any stomach discomfort. If you ever forget a dose, take it as soon as you remember unless it's close to the next one. And always finish the full course, even if you feel back to normal before it's done.
Got it. I think I understand now. You've explained everything really clearly. Thank you for taking the time. I was feeling pretty anxious earlier, but I feel much more confident now.
I'm really glad to hear that, Mr. Henderson. You're doing very well and you've made excellent progress. We'll continue to monitor you until discharge later today, and I'll come back to give you your medication plan and contact information for follow-up support.
Thank you so much, nurse. You've been very kind.
You're most welcome, Mr. Henderson. Take care of yourself, and remember, if you have any worries at all, you can reach out for help. You're not alone in this.